Good morning. My name is Dr. Carmen Castillo Gallego. I'm a geriatrician and researcher at Complejo Hospitalario Universitario of Toledo, Spain, and member of the Global Frailty Network. We are in the International Conference on Frailty and Sarcopenia research in Toulouse, France. And it is my pleasure today to interview Dr. Miquel Izquierdo, who is the creator and main researcher of Vivifrail, which is a multi-component exercise program for frail elderly. And it is an evidence-based and cost-effective program that has shown impressive improvements in terms of function, cognition, and other clinical outcomes. He's going to deliver a keynote speak in this meeting in Toulouse. So let's start with the first question. Informed by the results of your research, if you have all the money and resources you need, how would you implement Vivifrail in real-life care settings?
Yes, it's a good question because we don't have money actually. But if I had all the money and resources I need, I will implement Vivifrail in real-life care settings in the following steps. First of all, I will develop a comprehensive training program for healthcare providers to ensure that the successful implementation of Vivifrail healthcare providers will need to be trained in the program's principles and exercises. Secondly, I will provide equipment and resources, very important point, to facilitate the implementation of Vivifrail. Healthcare providers will need to have access to different kind of equipments and instructional materials. Also, I will develop a screening process. It's very important to ensure that Vivifrail is provided to those who benefit the most. A screening process will be developed to identify other adults who are most at risk for frailty. Also, I will provide ongoing support to ensure that older adults continue to participate in the program and achieve long-term benefits. And also collaborate with the community organization. This is very important to reach a largest audiences and promote sustainability. That is the key point of exercise, to promote sustainability and adherence to the program. And also I conduct research and evaluation because it's important to ensure that Vivifrail is effective and that implementation is successful. Overall, the implementation of Vivifrail will require different things. Require a comprehensive approach that includes training, equipment, resources, and also screening, ongoing support, collaboration with community organization, and ongoing research and evaluation.
Thank you. And the second question, COVID-19 has been a major driver for an epidemic of inactivity among the older population. What work have you done to ameliorate the consequences of inactivity?
Well, the COVID-19, we already know that has had a significant impact on physical activity levels among the older adults. And to ameliorate the consequences of inactivity among older adults, during the pandemic, several strategies have been implemented with Vivifrail. I can just mention a couple of them. First, telerehabilitation. Telerehabilitation with Vivifrail has been used to provide older adults with access to physical therapy and exercise programs remotely. Also, we have developed with Vivifrail virtual exercise classes because virtual exercise classes have become increasingly popular during the pandemic.
Yeah.
Also, with Vivifrail, we have made, because it's the essence of Vivifrail, home exercise program. Many organizations, as well as our organization, have developed different kind of programs, especially with home exercise programs. We have also promoted outdoor exercise. Indeed, we have developed some videos for make Vivifrail outdoor exercise. And very important is that we have developed education and awareness campaigns that to inform older adults about the importance of maintaining a physical activity for health and reduce risk of falls.
Yeah, actually those videos are very useful. Question 3, you have conducted clinical trials in diverse care settings. What are the challenges of implementing a program like Vivifrail in the community or in the hospital?
Well, In the community, we have many following challenges. We have limited resources. Community settings may have limited resources and staff. Vivifrail requires specific equipment such as assistance bands, balance boards, which may not be readily available in the community setting. Lack of transportation. Older adults who live in the community may face challenges with transportation. Cultural barriers. Also, Vivifrail may also have some cultural barriers that may be a challenge in the community setting. And implementing, this is in relation with the community. In relation with the hospital setting may face the following challenges. Limited time. You as a medical doctor, hospital stays are often short and staff may have limited time to provide the necessary support for the program. So some of the medical doctors are not thinking in prescribed Vivifrail and exercise. So this is the first. Secondly, patient acuity. Hospitalized patients may have a higher level of acuity and may require more medical attention, making it difficult to prioritize Vivifrail. Staff in the hospital setting, we have to recognize that maybe not be training in exercise and they are not thinking in exercise. And also hospitals may not have the necessary equipment available for the program. I think that these are the main challenges that we have with the community and with the hospital for implement Vivifrail.
Okay. And now our last question is, what are the predictors for the successful of Vivifrail in the older population?
Well, this is a very complicated question because indeed is the key of the questions about how we have to implement exercise in the population. First of all, with aging, with older population, with frailty, we have different points, with different predictors. First, the baseline level of frailty. The success of Vivifrail may depend on the baseline level of frailty in older adults. Those who are less frail may have easier time improving their fertility status than those who are more frail. So baseline level of frailty is very important in connection with exercise. Age also is a predictor of the success of frailty because older age may be associated with higher level of frailty. Gender also, there may be gender difference in the response to exercise. We have proved that maybe women potentially respond better than program than men, but we have to test this, to test this hypothesis. Motivation is very important with exercise. Older adults who are motivated to improve their fertility status are is more important than those who are not motivated, and especially older patients who are in the hospital, some of them, they are not motivated. Also, social support from families, from friends, from environment is important predictor of success with frailty. Adherence, sustainability are the future that we have to understand how to manage. The extent to which older adults adherence to Vivifrail or to exercise may be the strong predictor of success, and we have to work on that. Finally, I would like to say the last predictor is comorbidities. Older adults has a lot of comorbidities, chronic disease, cardiovascular disease, and these are quite important when we are talking about exercise.
So thank you so much for your time. And that was it for today, for this interview.
Thank you for the opportunity to be here and to exchange some information with you.
Looking forward for your keynote speak.
Thank you very much.